right, so welcome back to Lifestyle Blueprints. The special guest, please welcome Dr. Kai Chen. He's a third-year anesthesia resident at Queen's University, and all in all, one fantastic dude. So thank you, Kai, for coming onto the podcast and sharing your life story, your professional and academic experiences.
Thanks, Jordan. It's great to be here and to chat with you. Just to let people know a little bit about myself, I am a third-year anesthesia resident at Queen's University. I did my medical school at Queen's as well. Decided to stick around for another 5 years to complete my anesthesia training here. And then we'll see what's in store for me afterwards. Outside of medicine, outside of my career, I'm really into music, both listening to it, going to shows, as well as playing music. I used to be in a few bands, play the guitar and the drums. And yeah, it's just kind of a nice way to keep me well outside of work.
Perfect. Great. Yeah, no problem, man. Thank you so much for coming on again. So let's go back to kind of the roots. Where are you from?
So I'm from Toronto. I was actually born in China. So I came to Canada when I was about 7 years old. And my parents decided to settle in Toronto, like I think a lot of first generation immigrants. And I basically lived there until university. So in undergrad, I went to McMaster in Hamilton. So I was there for 4 years. And after that, went straight into medical school. And I was at Queen's. So now I'm in Kingston, and I've been living here for the past 8 years now. And it's been pretty great.
You're basically at a townie now in Kingston, I guess. Kingston
Almost,
townie.
yeah. So
almost, yeah.
By the end of my residency, I would have spent more time in Kingston than anywhere else in the world in my life. So pretty much.
True. So being from Toronto, why did you choose to go to McMaster's University for your undergrad? So let's talk about that.
Sure. So when I was in high school, I was trying to decide what I wanted to do. And I knew I wanted to do something that was related to the life sciences, whether that eventually meant a career in medicine. At that point in time, wasn't 100% sure, but it was definitely something on my radar. And so when I was looking at different programs, I wanted to choose a place that was close to home, but yet not too close. So I looked at different places like in Toronto, life sci program there. I looked at Mac's life sci program. And then one of my friends told me about this program called Health Sciences at McMaster. And she told me that was a fairly good program, fairly prestigious, not easy to get into, but she told me to check it out. So I did. I applied to that. I applied to a bunch of other programs. And in the end, I decided to go to Mac Health Sci. And I think that was a great choice. Like overall, I really enjoyed my time there. I thought the education was definitely top notch. And also living in Hamilton was great too, because it was really close to home, but not in Toronto. So I didn't live at home, which is kind of nice. But it was close enough that I could go back to visit whenever. And it was sort of the perfect stepping stone for the next part of my life, which is going to Kingston for medical school, which is just a little bit further than Hamilton is to Toronto.
Awesome. So with health sciences at McMaster's, how did it facilitate your path to med school? Can you tell me more about kind of the undergrad program and how it prepared you for med school?
Sure. So I think a lot of people view health sciences at Mac, especially as sort of like a feeder program into medicine and other sort of medicine related fields. And I think, part of that is true because of just the people that go into the program. Like a lot of them probably have medicine in mind as a career in the future. So there's a bit of a selection bias there. But I think the program is really great at sort of at preparing people as well, just in terms of the life skills, the soft skills that you need to succeed, not in just medicine, but in a whole bunch of different careers. I have friends who ended up going into consulting, people who ended up doing public health, people who are physiotherapists and allied health, et cetera, and dentistry. So the program really emphasizes like self-directed learning, and a lot of sort of emphasis is placed not so much on like memorization of facts and whatnot, which I think a lot of people are used to doing in undergrad. But they kind of focus on things like how to communicate better, how to work in groups, how to reflect and both give feedback and also receive feedback And I think those skills are incredibly useful. And I think really a lot of undergrad programs should be focusing on these things because they're lifelong skills that's going to be important, and it's going to be very basically it's very useful no matter what you do in life. And so
Yeah.
I think health sci there really did a good job in sort of preparing us for that.
Sure. So, with the soft skills being developed during undergrad, as well, like you were saying, so were there any courses that stood out to you and that kind of translated into med school and to you right now into your everyday life as a resident?
For sure. Well, I mean, there's the obvious ones. So, as a doctor, you have to know quite a lot about anatomy, physiology. And I did take those courses in undergrad. At the time when I went through Mac Health Sci, it was mandatory. So, in our second year, we had to take this course, and it's pretty tough. Like, there's a lot to remember, a lot to know. It's probably one of the hardest courses in undergrad. But that one for sure had sort of direct relevance to what I'm doing now. There's a couple of other courses that really stuck out as well. Things like statistics and like critical appraisal of literature. I think when you end up in any sort of career that looks at the medical literature or scientific literature, it's important to have some of the knowledge and the skills when it comes to that. And to this day, I still use a lot of the skills I've learned in those courses. So those were really useful. And then just speaking a little bit about some of the other courses that didn't really have as much of sort of the memorization, more sort of emphasis on the soft skills. There's one course I took called communications. That was a really interesting one. Like basically what you do is you read up all these articles on how to be a better communicator, basically. And every day during class, you would have like a scenario, like there would be like a standardized patient kind of thing. And you would learn, you would practice sort of communicating with that person. So the entire course is sort of built around how to be able to communicate with people, especially talking about sometimes very difficult topics. That one was really, really interesting as well.
For sure.
There's another one I just want to touch on as well, where this one was more so for self-development, I think. This course looked at sort of the intersections of health and a couple of different really topics that don't really seem related, but are. So part of this course, they were looking at forming healthy habits. And there were three different pillars that they were looking at in particular. And it was mostly based on the experiences of facilitators and instructors in this course. One of them was like physical activity. So that one's really key. And I think everyone knows that being physically active is really important for not just your physical health, but your mental health as well.
Yeah.
That one also learned how to meditate in that course as well. So one of the instructors teaches mindfulness meditation. And as part of the course, he basically walked a lot of people, everyone through how to do mindfulness meditation and how to incorporate mindfulness into your everyday life. So that was really cool too. And then the third part of that was actually looking at using theater. So using tools that people use in theater to communicate or to reflect on certain topics or themes. And that one was really great for me because I was kind of a theater kid before too. I was in a whole bunch of different theater productions, musicals, things like that. Eventually, at the end of my undergrad, I directed a musical as well. So I think there's a lot to be learned from the arts and from like drama. And so I think even a lot of the skills from there you can take with you and still use like today in terms of how to listen to people, how to empathize with people, and how to communicate really.
Yeah, for sure. And probably being a doctor, you'll be really good at communicating your thoughts to the patients as well as your colleagues as well. So that's awesome to hear. So before you jumping into undergrad studies at McMaster's, did you have any external or internal factors, or not factors, but inspirations that led you to wanting to pursue medicine?
Yeah, for sure. So the most salient one I have in mind is my grandfather. He was a physician in China, and when I was growing up, I spent a lot of time with him. And so he was a pretty big inspiration for me. Now, unfortunately, he became quite ill when I was young. So I did spend a lot of time in the hospital visiting him as well. So I think a lot of those experiences probably shaped me more than I really am aware of. But when I reflect back on it, I think that was a really important thing that happened in my life. Because most of my family members, they're all in business. And so there's very few people in my family who's actually in sort of the medical field. And so, and so even as a child, I sort of had the thought that maybe this is something that I want to do. And I think maybe a lot of people who are first generation immigrants or have parents who are um, very particular, they might be able to relate to the fact that they get pressured into various careers.
Yeah.
And, I think I was really lucky. I was really blessed not to really have had that much pressure from my parents. Um, because I think a lot of it for me was very sort of self-driven. Like even when I was young, this is something that I wanted to do. So they didn't really have to encourage me in one way or another. Um, and I'm quite thankful for that. Yeah, my parents are pretty chill for Asian parents, honestly. Like very,
For Asian parents,
yeah,
for
they're
real.
very
That's
lucky.
awesome.
Yeah.
Yeah, they kind of give you like the leeway, right? You choose your own destiny, but if you're going to choose that destiny and that passion, obviously work as hard as you can, and that's what you've done to kind of lead you to where you are right now. So I just want to ask you, I guess, tips and guidance going from university into med school and what that process is like. Can you kind of tell the viewers and the listeners about that?
Sure. So I think the journey is going to be different for everyone. So I'll speak a little bit about my own, and hopefully
Sure.
it'll be useful for people. But again, I think there's so many ways to get to a destination that, and it's just because I've had this one experience doesn't invalidate other ways to get there. But essentially, I think that I was in a great undergrad program to really prepare me for entry into medical school. And I also did a lot of, I worked really hard, like I hustled a lot in undergrad. I did the MCAT in the summer of my second year. So I studied a lot for that. Basically spent an entire summer working and studying for the MCAT. And then the courses I took also wanted them to fulfill the prerequisites for some of the medical schools I wanted to apply to. So there was that. And of course, studying hard, making sure that you're also somewhat like balanced in your life. So not just focusing on your academics, but having things outside of that as well that make you a well-rounded person. So I think nowadays a lot of people are looking for that, that people aren't just sort of have their head in the books, but rather that they're sort of developing a bunch of other skills, becoming more well-rounded individuals in general. And so I did a lot of extracurriculars. I think I already talked about one. I directed a musical in one year. There was various student government roles that I took on. I ended up teaching the MCAT as well in the last in my third and fourth year undergrad. And so I had some research experience as well. I think first research is kind of hard to get, especially because you don't have any experience. And so you're kind of
Yeah.
just like cold emailing people, being like, hey, can I jump on this project? Or like, can you take me on as a student?
Yeah.
And that can be pretty difficult to find a project, but I was lucky I was able to do that. And I had a really good mentor too. So we ended up
Awesome.
publishing a few papers together, which ultimately allowed me to get another research job that was more legitimate because it was like a full lab. It was funded and everything. I ended up doing my thesis with that group. It was in the hematology lab. And it ended up publishing a paper with them as well. Not that the field I'm in
So
right now is definitely not related to, well, there are some stuff I still use from that lab, but like I'm not like a hematology resident, but like there's still skills and knowledge that kind of
yeah, no,
today.
for sure. And Kyle, I was just going to ask you, how many publications did you have in undergrad then, based on what
Oh
you're
man.
saying?
Let me try to count. I think probably like four or
That's
five.
like That's like unheard of as an undergrad student. So kudos to you because you hustled. You did these emails to get all this research experience.
Yeah, no, you know what? Looking back, I like worked really hard, and I don't think I worked nearly as hard these days as compared to back then when I was like hustling for this. But I mean, yeah, I think that because also the nature of like how competitive it is, I
Yeah,
think a lot of that sort of maybe drove me to be more competitive, or maybe I had more anxiety or something. And so I really sought out certain opportunities to better my chances. Yeah.
true. I guess based on your pathway, you did a science undergrad. Would you say that's the only way to go, or should people not narrow their scope in terms of applying for an undergrad and only science? Like, should they be applying for arts and science, or like how would an individual who is aspiring to be a med school student, like what program should they take specifically?
Yeah, like I said again, there's so many different ways to get to that destination if that's what you want to do. I think that's still the most important thing is doing something that you enjoy.
Yeah,
So if you, for example, if you do like the arts, I think it's really totally reasonable to have incorporate that into your education. In fact, there were classmates of mine who came from like an arts background, and they were some of the best students that we had, um, because I think they bring with them a very unique set of skills and perspective that we can often learn a lot from them as well as colleagues. And even though I was in a science sort of undergrad in a way, I took a lot of non-science courses as well. Like I said, like I took some arts-based courses, drama-based courses.
yeah,
I almost minored in psychology as well.
really?
Yeah, because I found just like psych was so interesting. Like I took intro psych in first year, and I just thought it was like really interesting because it gives you like a window into like how people think or behave, right? And I just thought it was really fascinating. Anyways, I almost minored in it. I think I only needed like two more courses, and
Oh,
I would have had
nice.
a minor in psych. Yeah.
Nice. And then that process from going to, I guess, undergrad to med school, can you describe the process, like application wise, and were you super anxious and stressful during that time?
Yeah, I think everyone around me also was very anxious and stressed. And so the environment that you're in really can accentuate whatever experiences you're having. The I think that it's normal to have those feelings because of the nature of it being sort of it is something that you want to do, right? It's like pretty high
Yeah,
stakes for you if it's that important to you, right?
yeah,
So yeah, I think it was in some ways pretty stressful. But at the same time, I found ways to cope with the stress, and I thought that I had worked on a few years of building experiences and building skills that made me a good candidate. So I think at the end I felt prepared for the challenges, and in the end, I was lucky. I think a lot of it is also dependent on luck too.
okay,
Like no matter how much you prepare, there's definitely a big element of luck. And one example I'll give you of that is just imagine being on the other side. And I have been on the other side in the sense of interviewing students and whatnot for medical school admissions. And it's really interesting because I think a lot of the times, if you connect somehow with the applicant, then there's a higher chance of you grading them higher on whatever rubric you're using. And so I think that a lot of it will depend on luck in the sense that, like, a lot of what you're going to be graded on, a lot of that depends on who's reading it,
yeah,
right, on the other side. And if that person somehow connects with you because you're similar or they have had similar experiences, then you're lucky because you're probably going to get a higher score than someone who can't really relate to you.
yeah,
So always
for
keep that
sure.
in mind. So, if you don't succeed, it's not always because of what you've done or what you didn't do. Sometimes it really is just kind of like a luck of the draw kind of thing.
True. And I kind of want to talk about the competitive nature maybe during your undergrad at McMaster's. Was there kind of a competitive edge between all these students who are driven to pursue med school? And if there was that competitive nature, did it make you strive harder to reach your goal?
Uh, I think we definitely did. It was pretty competitive. So I think, I don't know the exact numbers, but it felt like to me when I was in House I, probably 70% of people to 80% of people wanted to pursue medicine, like
Okay.
in a program of like 150, 200 people.
Okay.
So that's a lot, right?
That
There's not
is a lot. Yeah.
lots across the country. There's something like 4,000 to 5,000 applicants a year that apply to every school. And so yeah, so there was a lot of pressure, and these students were really phenomenal too. Like they were very smart, they were all very driven, had great extracurriculars, and so you can't help but sort of compare yourself to others. And I think it can become really taxing on you, and especially in terms of mental health. I think a lot of people get quite anxious, really stressed out when they think about that, because there's sort of this constant comparison of
Sure.
yourself and others. And I think it's really important to recognize that. And when you see that, take a step back and just remind yourself of your own personal reasons of why you're doing something that you're
Yeah.
doing, and trying to be genuine in that sense. Because if you're just driven to do something because everyone else is doing it, and in the back of your mind or in your heart, you know that it's not something that you really want to do,
Yeah.
that's only going to end up being bad down the road.
No, for sure.
Yeah.
Yeah, and with the stress and the anxiety, I guess that maybe you have experienced, do you have any examples, or I guess any techniques, or what did you do to kind of relieve the stresses and the anxiety during those times during undergrad to strive for medicine?
Yeah. So I think the most important thing was having a group of friends who sort of understood where you're coming from.
Yeah.
So I like a lot of undergrads. I lived in like student housing. I had like 6 roommates on average per any given year, and most
Okay.
of us stuck around together. Most of us were in the house ed program. A few of us weren't, but we basically became really good friends, and half of us were like on the student government too. So it was kind of pretty jokes that
That is
we're
jokes.
like all sort of very tight. And I think having a really strong support network is probably the most important thing. Like we kind of got each other through the most difficult times. The other thing is like being able to find something that keeps you well personally. And I think this is incredibly personal to people. Like it could be very unique to yourself, and it doesn't matter what it is, as long as it's something that you're able to enjoy doing, um, outside of all the work and whatnot. I think it's important to have those and to keep those hobbies up. So, for example, like I play a lot of music. So I had a lot of like I was in a couple of different bands. I was playing like I was in a musical. I was like playing at coffee houses, open mics, things like that on a pretty regular basis.
Yeah.
So that part of it, like the music, really was something that I could always go back to. That was very sort of not the same as
No.
um, what I was learning on a day-to-day basis. So it was an important hobby to keep up. The other thing that I ended up doing was I started like working out in undergrad too, pretty regularly. So going to the gym, having that sort of physical activity um, is important too. Having a healthy body, a healthy mind are all interconnected.
Yeah.
And then speaking of a healthy mind, like one of the skills I alluded to earlier, like the mindfulness meditation, that piece really I think is actually quite important. And to people who haven't ever heard of mindfulness, and there's a lot of advertisement and like apps nowadays on how to meditate or how to be mindful. But in a nutshell, it's basically just being aware of the present, being in the moment, and approaching the present without any judgment, and so or attachment. So that's really the sort of the gist of it. And even if you just meditate for like 10 minutes a day, just like literally spend 10 minutes doing nothing, but like sitting there, like observing your own breathing or your own thoughts that go through, even that, if you do that consistently, it does make a difference in terms of your mental health, I found. So like there are a bunch of different things that I used to help cope with stress. And I still use a lot of these strategies like today. Like right
That's awesome.
before our talk, like I just did a little bit of meditation. So
That's awesome.
yeah.
And for the viewers and listeners, what apps would you recommend, or what do you use for meditation?
I haven't you really tried too many different apps. I use Headspace.
Okay.
Probably because it's the best, like best known app that's out there, and I've
Yeah.
also heard from various people that it's pretty good.
Okay.
I've seen quite a few like YouTube videos of guided meditations, and some of them are pretty good. Some of them I didn't really like. And then when I tried Headspace, because you can do like a limited time trial kind of thing. When I tried it, it's very minimalist, which I think is like perfect. That's exactly what you
Yeah.
need in the guided meditation. No frills. Like you don't need like this crazy music in the background or whatever. It's just a lot of it was actually just silence, and I like that because I think that's exactly what the meditation piece should be. Like you just need a guide for the first little bit, and then eventually you'll be able to do it on your own.
True.
And it
True.
reminded me of actually when I was taking the course in undergrad.
Oh yeah. True.
Reminded me of that guide as well. So I think, yeah. So I think that's probably, I got a year subscription to it, so I've been meditating whenever I can,
That's
and
great. That's great to
yeah,
hear.
it's been good.
So transitioning fast, okay, I guess moving forwards into med school at Queens. So you went to Queens. Can you kind of tell me the experience at Queens Med?
Hmm.
Yeah, just tell me about it. The 4 years.
Sure.
You love it. You're smiling about it.
I know. I'm actually wearing like a Queen's sweater. It's like our
Shout out to Queens. Shout
Department
out to
of
Queens.
Anesthesia sweater. It's got like my name on it too.
K10.
Yeah. Yeah, so I love my experience at Queens. I think that it's a really like a very tight community. You know all of your classmates, and honestly, it's a class of 100 people, so it's
Okay.
impossible to hide. But you become really close to your classmates, and
Yeah.
you go through everything together. I also ended up living with a whole bunch of them as well, which is really nice because it can be pretty stressful too going through med school, and it's nice to have people who understand what you're going through, and to have like people who are like-minded like you. And yeah, and I think that Queens people are also very social on like in general,
Facts. Big facts. Yeah.
and that's been good because like yeah, like you don't just want to be like studying all day. You
Yeah.
want to have like other hobbies and like be able to hang out with people. And this was before COVID, so like we had a ton of parties and stuff. It was good.
Yeah.
It was really good. I think balance is the key word here. I
That's
think
awesome.
that the whole experience was like very. I think people were like well rounded. People were genuine. People were kind. People were smart. People were fun. So I think that generally was probably why I enjoyed my Queens Med experience so much.
That's awesome. So everyone's kind of like driven to obviously pass and become a doctor, but also are ready to just kind of like just let loose and have fun as well.
Yeah, so I think that people are quite. I think people sometimes underestimate the Queen students, just because we have
Why? What do you
this
mean?
reputation of being like party hardy and whatnot. But if you actually look at the statistics, like our match rates to residency programs is like the highest in the country, I think, in a few years. If you look at the past couple of years, like the rates of match are probably some of the highest in the country.
True.
And I think part of that, the education is top notch for sure. But I think that the people also, people I think are pretty well rounded, like the people who go to Queens in general. And
Yeah.
I think that that's an important thing that residency programs look for these days as well.
That's
It's
awesome.
not just people who are going to be like smart or skilled, but like people who are able to take on the challenges and stresses that come with residency and have the resilience to be able to go through all of that.
For sure. And now going from like undergrad to med school, how are like the evaluations and like the exams? Can you tell me more about that?
Sure. So I think there's a lot of changes that happen. With each transition, like from going to high school to university and then going from university to like med school, there's a lot of
Yeah.
transitions. In university, it seemed like a lot of courses are based on like your marks and like how you do. Obviously, you're graded on whatever point scale depending on the university you go to. And then that's comprised of things like assignments, exams, and usually a lot of courses really heavily emphasize the exams. And the better that you score, you know, the better you're going to get and better mark you're going to get. And then that could potentially influence where you go in the future after that. And I think that they have to do that because there's just so many people in university that a lot of the marks have to be like based off of tests that they can administer like en masse kind of thing.
Yeah.
Some of the courses I took in undergrad, luckily, were very small. So there were maybe like 15 people in the class. And in those kind of classes, your marks a lot of times was based on like participation, discussion, like assignments, essays, group projects, things like that. And that probably more reflects what happens in the real world as well. It's just that a lot that's really resource intensive, right? So a lot of undergrad programs can't offer that. And then in med school, all that changed because a lot of it now is just like pass fail.
Okay.
So you just have to achieve like a minimum, like the bar is set here, you just have to go past it. And if
Okay.
you do, then you're okay. Really, what happens at the end of med school is that you go through a matching process and you apply to various residency programs, and your success on that match is often based on letters of references, your performances at different electives when you rotate through them, and not so much based on your marks anymore. It's no longer
Okay.
like a numbers game.
Okay. Yeah. I wanted to ask you, I guess like how much more did you study for these exams? Because you still have to meet that minimum bar to pass, right? So these exams and like the difficulty as well. Like how much more time did you devote to these exams?
Yeah, you know, to be honest with you, I think that I studied more in undergrad, like in
Oh,
terms
okay.
of the amount of time that I dedicated to it, just because the fact that like the more that basically I thought that in undergrad, the more I studied, the better mark I'm going to get, and that's going to
Yeah.
have a direct correlation with my chances of getting into whatever program I apply to in the future. In med school, it's just, again, you just have to meet that minimum bar. So you can study just enough to pass it and still get away with doing that,
Yeah.
you know? Like you don't have to achieve, you don't have to aim for like the 99%, 100%. Like
Yeah.
you can literally just aim for like a 75% and be fine with that. And so I think because of that, I didn't push myself as hard. Obviously, you still have to study, like you still have to know bare minimum. But I
Okay.
think because of that difference, the pressure isn't quite there to like study super intensely.
Okay. I was curious too about kind of like being in class with like 100. You guys are all dedicated med students, and the prof being there, kind of like lecturing, asking questions. Did they ever pick on you guys randomly, like on the spot, like you don't know the thing, and then you're just like,
I think so. I think there's been a few times where they'll like point. Usually, what happens is like we're in the group, like
yeah,
our group is all sitting together, and then the instructor will like point to a group, and like someone from the group will have to be like a spokesperson, and it's usually the loudest person in the group. So the person who knows what they're talking about. So that person usually offers up their answer. Most of the time, it's still voluntary.
yeah.
Uh, but if they don't get a volunteer, then they just pick someone.
Okay, true. So moving on from med school to anesthesia residency, and that's where you're in right now. Your third year. Tell me about that. Tell me your experience so far as a resident, I guess, in anesthesia.
Sure. So it's been really rewarding so far. I love what I do, and anesthesia was my top choice in terms of the specialty that I wanted to do.
Yes, sorry to cut you off. Actually, tell me why you want to do anesthesia based on all your electives throughout med school. We should have started with
Sure.
that.
Yeah, sure. Well, okay, maybe I'll start with that. Like going into medical school, like I didn't really know, I didn't even know what anesthesia was, to be honest. Like I didn't
Okay.
know that was like a specialty within the medical field. So
Yeah.
yeah, I first thought that maybe I want to do something like internal medicine.
Okay.
It's like hospital-based, patients are sick. It's like complex. There's a lot to think about. I thought, oh, maybe this will be interesting. Like it'll probably be very challenging. You have to think a lot about various different processes, pathophysiology, etc. So I ended up shadowing a few internists, and to be honest, I was quite bored. Like a lot of the times, I don't want to I don't want to say anything bad about the specialty because I think it's a really great specialty for various personalities. But I think that a lot of the times what I found was there was a lot to think through, but like you do a lot of that. You think there isn't a lot of doing. Like you kind of like think, you make like small adjustments, and then you wait a long time and see what happens. So I didn't really like that. It was like, this is kind of, no offense, but this is kind of boring. Uh, and then, I had a few like instructors in my small group facilitative classes who were anesthesiologists, and I ended up shadowing them, and they did a lot more. It was like they had to think not only about like the disease process and all the pathophysiology and think through that, but they had to like act. Like there was a lot of doing. Like you literally put in the IV yourself, you put in your lines yourself,
So
you
hands on.
yourself. It's very hands-on. You drop the drugs, you give the drugs, you see the effect right away. I'm pretty impatient as a person. Like being able to give a drug and seeing the effect right away, that's awesome. I'm like, wow, it's like took 30 seconds for me to get this patient off to sleep. I pushed the drug, 30 seconds later, they're asleep. I don't have to wait like 2 days and then ask my nurse, like, how did the patient do? Like, so I think that part of it being like directly connected to my patient and like um, doing everything sort of yourself and seeing the effects right away, being very hands-on, at the same time thinking through a lot of that pathophysiology and the complexities of medicine, that was really interesting to me. Yeah. And I honestly, I didn't have the patience to be a surgeon either, because like they sometimes operate for like hours and hours on end without taking a break. And
Yeah.
I found the surgeries to be interesting, but I just wasn't as interested in that as sort of like thinking through some of
Yeah.
the physiology of the patient. Yeah.
True, Kai. So that leads me to, I guess, ask, well, just for the viewers and listeners, tell them what an anesthesiologist does. You're saying like, oh, putting lines in, putting them off to bed, like, yeah, shutting their eyes,
Yeah,
doing
yeah,
that.
yeah.
Tell them what the job entails.
Yeah. So the most of what anesthesia is about is basically rendering like a state of unconsciousness in the patient that
Okay.
you're able to facilitate things like surgery. So
Okay.
really, that's most of the job, is getting patients through surgery, whether that be for like an elective procedure, like an optional procedure,
Yep.
or like emergencies, like if a patient comes in and they've broken a bone and you have to fix the bone, like the orthopedic surgeon has to fix the bone, well, they're going to need anesthetic. So you either get them off to sleep, and the surgeon can do their operation, or you numb up whatever limb is broken, and then basically the surgeon can operate on that with the patient still being awake, just because they can't feel anything. And so that's most of the job. Also, anesthesiologists work in places like the intensive care unit,
Okay.
because a lot of those patients end up being sedated. They end up being placed on ventilators, and anesthesiologists have a particular skill in terms of placing like breathing tubes in people, and you need that in a lot of cases in really ill patients. And so a lot of anesthesiologists will work in the intensive care unit as well.
Okay.
We in the OR we give medications to treat pain. We give medications to treat like blood pressure, heart rate, all of that. Basically, we control your body's physiology while you're asleep getting a surgery or getting some sort of procedure done.
Okay. Awesome.
Yeah.
That's
We
awesome.
also work in like labor and delivery as well. We place like labor epidurals. So
Okay.
they're like these like plastic catheters that go into people's backs, and it gives like this numbing medication, and it basically provides like really good pain relief for labor. 'Cause
Oh,
labor is
cool.
painful. So yeah, so we can do that as well.
That's cool. So Basically GIM, but with hands-on stuff. Well, I guess like you're saying, like the knowledge
Yeah,
and stuff. Yeah.
I mean, there's overlap, and I think a lot of internists who end up liking the procedures and liking the acute illness and managing like that kind of stuff, they end up doing like intensive care. They do a fellowship in intensive care, and intensive care has a lot of overlap with anesthesia. There's a lot of anesthesiologists who also work in intensive care. So that's really where the overlap is. Yeah.
Cool, cool. And then, so that leads me to ask you, how is your experience so far as a resident at Queen's University and working at those two hospitals?
Uh, yeah, so it's been pretty good. I think that really anesthesia is an awesome specialty because we have such a great work-life balance, like in
Okay.
general. I don't envy my surgery colleagues who have to work very, very long hours, often don't get very much sleep. Um, yeah, but they have an important job to do, and that's just the nature of their job. Whereas for anesthesia, we have a good work-life balance. Like we're usually have very reasonable hours. When we're
Yeah.
on call, like overnight kind of thing, we work really hard, but at the same time, we get usually that day, the morning of that day off as a resident, and also the next day, we get that day off as well. So there's a lot of things that are built in now into residency to really help try to promote like well-being outside of work, because can be a really tough job and a lot of people burn out.
Okay.
Yeah, so
Which
it's been good at Queens though. They're very good at balancing your sort of work
that's
life. Yeah.
that's awesome. And then, with that being said, your third year, what's next after third year for you?
So ANSYS is a 5-year residency program,
Okay.
and by the end of our 5th year, or I guess it's in the middle of our 5th year, we write this big exam. And once you pass the exam, then you can start practicing right after the 5 years in almost any like hospital as an anesthesiologist. A lot of people after that, most of the people end up going just straight up working. If there are jobs, they're very able to find jobs. But a lot of people also do fellowships, so they pursue additional training. There's various subspecialties in anesthesia that require further training, even more than just the 5 years you're doing. For example, like cardiac. If you want to do like cardiac anesthesia, you have to do another at least a year. There's other specialties are like regional anesthesia, so that's what I'm interested in. And regional focuses on using nerve blocks to provide anesthesia and analgesia, so pain relief. And nowadays, most of those blocks are done using ultrasound.
Okay.
And it's that's an extremely hands-on subspecialty. So that's why I like it so much. And then there's also fellowships in like pediatric anesthesia. So you can do surgery for like tiny little babies. Yeah.
Awesome. That's awesome. So regional anesthesia is what you want to do.
Yeah.
Great. So you were talking about burnout, and I'm conducting a study for resident education at Mount Sinai in Toronto for resident well-being, burnout, fatigue, as well as the other side of things, patient outcomes based on your guys' schedules, either 16 or 24 hours. I don't know what your call schedule is, but have you experienced as a resident kind of that burnout and the fatigue of like the fatigue and like your well-being being like deteriorated, like
Yeah.
it deteriorating? Have you experienced that?
Yeah, that's a really good question. So I think burnout can look different depending on who it affects. But like I can speak a little bit maybe about my own experience because I have experienced burnout pretty recently. Um, so my call schedule is 16 hours, by the way. It's not a
Okay.
24-hour call schedule, and I'm very thankful for that. I think that that's really the right way to go because there's plenty of studies that show now. I think that if you work like 24 hours straight, your mind, it's like you're on drugs basically. It's like you've had a couple of drinks. Like you can't make decisions properly, let alone like decisions about someone's life and well-being, right? So I think that the 16-hour like cap is really important, and that might even be reduced even more in the future. But basically, what burnout felt like for me was I like because of the coronavirus, I didn't take vacation for like 6 months straight, basically, because I was trying to save all my vacation days till
Yeah.
the end of the year because I was hoping to be able to wait out this pandemic and be able to travel again, because I really love
Yeah.
traveling. I love going to different places and experiencing different cultures and all of that. And I was planning on taking all my vacation days at the end of the year when it's a bit warmer. I can go traveling again, hopefully. And so I hadn't taken any vacation for 6 months, and then that was a mistake because I just basically kept working all through that time, including 2 months in the intensive care unit on ICU, and that was brutal. So you work very long hours on ICU. Our call shifts are still 24 hours to 30 hours sometimes, so it's extremely busy. Um, and and basically what I felt was I basically was not as focused at work as I would like to be. I also found that I was a little bit like short tempered. I just didn't have as much patience
Irritability.
for things. Yeah, I was irritable. Exactly. That's a really good word. Like I was just felt irritable. Like things, like small things that didn't used to bother me could really, throw me off. Um, I also felt that I was like just generally less happy about things
Yeah.
and more tired.
Okay.
Yeah, and part of the reason for that is not just the sort of the 6 months of straight work, but it's also because with the pandemic, there were a lot of things that I can't do anymore that I used to do a lot that kept me well, right? So,
Yeah.
hanging out with friends, going out, like going to shows, things like that. You can't do that anymore. Also, the gym was closed for a long time. I'm
Yeah.
sure that's affected you too, bud.
Yeah,
I
for sure.
it was really rough. Like when they closed the gym, I didn't have any equipment at home at first. I've invested in some stuff now that I'm able to do um, like pretty much like anything at home. But for a while, I didn't have anything, so I didn't go to the gym as often. So that was not great. Which is another reason why I like recently went into meditation again, is because I was thinking I have to find a way that doesn't rely on all these other external factors to keep me like sane
Yeah,
and not get burnt out,
true.
or at least try to deal with that and not have it affect my patients and my colleagues and people around me. So yeah, so that for me, that's what burnout was like. It was basically like being irritable.
Irritable. It's so interesting to like hear you speak about burnout on a sick. I guess based without the ICU block, the 2 months of you doing 24 hours. But I was just curious: is 16 hours for anesthesia, like the on call, a standardized or normal throughout all the hospitals, or are other hospitals, or do you know that?
It's not standardized. To my knowledge, there's still a few anesthesia programs in the country that are doing the 24-hour call. Um, and when I was at CHIO doing pediatric anesthesia for 2 months in the fall, they also have a 24-hour call schedule. So
Okay.
you would go in, you work the full day, and then you'd stay in until the next morning, basically doing any on-call cases. So yeah, so depending on where you work, the call schedule is different.
True.
Definitely.
True. I think it's super cool because I'm doing the study, and it's nice to hear like your opinion about the two schedules, 16 versus 24, and then you think it's like 16 hours is perfect. But hopefully the study kind of like regulates that, like and creates policy for all residents across the board for sure.
Yeah, I
But
hope
it's
so.
but it's so cool hearing that from you, and then hearing the residents as well saying like, hey, like we love 16 hours, like we feel like prepared, like we're ready to go and like make great decisions, and they're not like burnt out. And I can tell physically too of some residents when they like look tired, fatigued, right?
Yeah. On that note, actually, there's a good paper that was published, I think, in the British Journal of Anesthesia, or either the British Medical Journal or the British Journal of Anesthesia. I don't remember, but they were basically, it was like a review article looking at ways to like get the most out of shift work. And some of the strategies that are like evidence-based that they sort of talk about are things like taking a nap during the day before going to work, if we were
Okay.
working nights, for example. And then when you come home, making sure that there isn't too much light if you're planning on taking a nap when you come home, not having a cup of coffee like you always do in the morning kind of thing.
Yeah.
There's a whole bunch of strategies, and you can't use those strategies if you're doing a 24-hour call shift. There's no time. So I think that if you're going to be doing this on a long-term basis and not suffer severe sort of consequences from
Yeah.
doing that, I think you need to start like using these strategies like right away from the start.
True.
And an easy way to do that is by making the time for it when you have
Yeah.
16 hours instead of your 24 hours.
True. I don't know how to put this across for this question or like ask you, but I guess some physicians, even surgeons, may have lives at stake when they are performing surgeries, or even internists, or anesthetists as well. Is there a dark side to physicians and doctors based on what they see? That's what I'm wondering.
Yeah, for sure. I think one of the coping strategies that a lot of us have, just because of the things that we see sometimes is just really horrible.
Yeah.
Um, and and one of the ways that we cope with that is honestly with like humor, believe it or not. It's often like pretty dark humor. So I think for the layperson, it can come across as being kind of insensitive,
Yeah.
or just kind of unbelievable that people would even joke about this stuff. But the fact that is that if you don't make light of certain situations, and if you take everything extremely, extremely seriously, it just weighs so heavily on you that it's going to burn you out so much faster. So a lot of physicians, now I know, including myself, will sometimes use like dark humor just to as a coping mechanism.
Okay.
And it's not like intentionally, we're not like intentionally trying to make a joke out of someone at someone's expense,
Yeah.
especially when they're suffering. But it more so happens because if we don't talk about things in a way that's a little bit lighter, if we don't process it using humor sometimes, then everything becomes very dark and very serious.
Yeah.
And then that's going to weigh on you. So that is a part of medicine for sure that I think, when you look at it from the outside, it's kind of like, wow, I can't believe people are like so they lack so much compassion. It's not so much that we're lacking compassion, we're trying to safeguard the last little bits of compassion we have left, because the job takes a lot out of you sometimes. And if you don't safeguard that, then you're going to have none left, and then you're going to not be able to provide care for people.
True. That makes
Yeah.
sense, and that's fair enough for sure. So just some quick hitters to line up the mood to kind of end off this great podcast. It's been a joy to listen to you speak about medicine and anesthesia specifically. Tell me your top 5 artists right now that you're listening to.
Top 5 artists, eh? Okay, let me just check my Spotify. I can tell you like what they are based on
Okay.
this. It's really interesting. So you know how Spotify gives you like a
Wait.
rap kind of thing, like it's
Yeah.
only wrapped.
Yeah.
So most of the songs I have on that are a mix of like electronic music and like musical theater, believe it or not.
Cool.
I listen to a lot of theater, so I do
That's
have to
sick.
say. So my favorite artist right now, his name is Ben Bomer. He's a German DJ, and his sort of music is very sort of progressive, melodic, deep house. That's how
Okay.
I describe it. So he's pretty good. I listen to a lot of him. I also listen to like Lane 8 quite a lot as well, and he also has like a very similar kind of style. And then the two soundtracks that I listen to quite a lot these days is the Hamilton soundtrack. So Lin-Manuel Miranda, he's a genius. So Hamilton, and also Dear Evan Hansen. That one's a pretty good soundtrack as well. And if I had to choose another artist, number 5, it's kind of tough. Let's see. I mean, there's so many, but I also listen to like Rufus a lot. Rufus Du Sol.
Oh yeah, yeah. He was supposed to play
Yeah,
last year.
Rufus and Odessa.
Odessa.
I
True.
gave you 6, but there you go. So
No, I love it.
it's mostly electronic, but I listen to like quite a lot of theater music as well because I used to do some of that
True.
just to
Um,
like things up.
I like it. I like it. Diverse listener. Um, let's say before COVID, um, what were your hobbies? Kind of like what you like to do. I know you were saying like going to shows and that, like that kind of stuff. But tell me more about that and like the hobbies that you would do outside of medicine and when you're on vacation.
Sure. So this summer, like Played a lot of like spike ball.
Oh, true. By
It's
the
kind of
pier?
a good sport to play like with somewhat of a social distance because you're like fairly far away from the other players and you just
Yeah.
following. So I found that was really fun this summer. We spent a lot of time at the beach. Yeah, I don't know if
The
you
pier. The
went
pier.
to the pier. Some
Yeah,
motivated. Yeah,
I did.
it's like there's like a sand beach there now.
It's sick.
It's sick. It's so nice. Like it used to be such a is
It was duddy. It
yeah,
was gross, bro.
there's like broken glass everywhere on the turf. Anyways,
Yeah.
it's beautiful now. So we spent a lot of time outside this summer. So I would so we would like play spike ball there on the beach kind of thing. I would I'll go traveling a lot. So like whenever I have time off, I usually try to take it like a week at a time. And I travel. So I either like if I have more time off, I'll go somewhere further, like go to Europe somewhere. Or if I don't have as much time, I go visit my sister in New York. And then when I'm traveling there, it's great because I get to see shows as well, like theater shows. I also like going to like electronic music festivals because I listen to a ton of electronic music. It's a great place to just like really let loose and like discover lots of new acts. Like I've discovered so many new artists just like going
Real.
the different, especially like the smaller booths and stuff. There's some really like upcoming or like not as well known DJs, but
Yeah.
there's some really awesome stuff. So I used to do that. I play a lot of music at home as well. I have a guitar. I would like to play the drums again. I don't have a drum set with me in Kingston, but I think eventually when I move into a bigger place, I'll probably invest in that.
Really
Um,
multi-talented, eh?
I go to the gym. Yeah. I mean, like, man, like if I don't have like all these hobbies, like it's not. I just need a lot to sort of keep me busy, you know?
Yeah, real.
Yeah.
That leads me to say, or ask you, I guess, your top three or top five, I guess. Let's do top five places that you traveled in the world.
Top five places. All right. Let me think.
Okay, no particular order. Just give me the five places that you.
Okay, I won't give you a particular order because if I have to order it, it'd be too hard.
Okay.
So one that really jumps out to me is Costa Rica. Have you ever been to Costa Rica?
Never.
Oh man, you got to go sometime. It's amazing. So I loved Costa Rica. It's so first of all, it's really easy to get there. It's pretty cheap. The flights are cheap. Accommodations are cheap, and there's so many different like microclimates there. Like you can literally drive for 3 hours and you go from like a rainforest to like a sunny like beach, basically.
That's
Uh,
cool.
yeah, it's amazing, and just like the nature, hiking there, all of that, the surfing that you can do. Oh, it's awesome. So Costa Rica is definitely up there for me. I also recently went to like Croatia, and Croatia was really beautiful too. Part of
Damn.
it was because like I used to be into like Game of Thrones and stuff, so we actually went to like Dubrovnik
That's
and
sick.
walked around there. That was awesome. Yeah, Costa Rica, Croatia is really nice. I also liked Spain quite a lot. There's we also this was like years and years ago, but I went to like Ibiza with like a couple of boys, and we party there for like a few days. We were like so broke too, like we had like no money. So I definitely would go back again just to party there when I like maybe have a bit more means. Uh,
Yeah, that's
it
so
was
hype though.
so much fun. Yeah, it's crazy, like high energy. I saw Avicii there, man. I was,
Damn, dude.
I was so
RIP to
blessed.
Avicii.
I know. I feel so blessed. I've seen him before he passed. Yeah, so that was great. Thailand was a lot of fun, and Vietnam was really great too.
Shout out to
I
Vietnam
did a
too.
dive in Thailand, so that was a very memorable trip.
True. Kai, so tell me experience with Avicii at Ibiza. How was that?
Yeah, so it's pretty wild, man. Like like it was crazy now that I think about it, how cheap the ticket was to actually see him. So he was performing at a hotel, basically. The hotel's not like it's not your typical hotel. Like it's like some sort of five-star resort where they have like this massive courtyard,
Yeah.
like lots of swimming pools and whatnot, like in the middle of it, and then there's a giant stage And all of the guests at the hotel basically can go on the balcony and watch the show.
Damn,
So
that's
it was
sick.
insane. And it was like close-ish to the airport on the island. So every like 30 minutes or so, you see like this plane that would like either be landing or flying, like taking off, and the crowd just goes crazy when that happens. And then you have like Avicii just like, yeah, throwing up his hands. It was great.
Damn, that's
Light
so
show.
hype.
It was really hype. It was very expensive, like the drinks there. It's like 12 euros for like a tiny bottle of Heineken.
No wonder you went broke.
I think it only costed us like 50 euros to like actually see him though.
Oh, that's awesome. But
Yeah,
12 euros for a small Heineken?
but yeah, but
That's
they get you with the
insane.
drinks, man. They get you with the drinks.
Damn, that's
Um,
insane.
yeah,
That's awesome. So I guess those are all my questions. It's been a great talk with you, and it's nice catching up with you.
yeah,
Super
man.
genuine and authentic, and you answered a lot of questions that I was kind of curious about, and hopefully you answered a lot of questions that the listeners had as well. So I just want to thank you, Dr. Kai Chen, for coming on and speaking to like the mass about anesthesia, Queen's Med, medical school in general, McMaster's, and just your whole journey. So super appreciative, man, and I wish you all the best in the future, and you're going to be a great physician.
Thanks for having me, Jordan. It was a
Thanks,
pleasure.
man.